Uncompensated care is on the rise in Wisconsin. The Uncompensated Health Care Report, Wisconsin Hospitals Fiscal Year 2019, was just released by the Wisconsin Hospital Association. It's showing that uncompensated care has increased by $90 million over 2018. That's $1.3 billion total in uncompensated care in 2019. Now, uncompensated care is a combination of both bad debt and charity care dollars. In the U.S. in total, it looks closer to $41.3 billion, and that's the January 2020 number. That report will be updated in January 2021. We chart what that looks like, the trend of uncompensated care in the state of Wisconsin, where we were making some headway in 2013 and 2014 after the opening of the Affordable Care Act Marketplace and consumer protections being implemented across the nation and in Wisconsin. But then we see that takes a turn once we hit 2015 into 2016, and that trend is continuing on an upward trajectory. The reasons? Well, more people uninsured, more children are uninsured. It's undermined market stability and segmented insurance markets that we see. There's more plans out there that aren't qualified health plans. They look more like junk insurance plans, leaving people vulnerable and at a liability for uncompensated care. And there's exacerbated healthcare costs and ever-changing program rules, red tape, and surprise medical bills. The result is that people have barriers to coverage, which means barriers to care. Uncompensated care is uncompensated to the provider, but it also means that the patient is left with medical debt. This is bad customer relations for hospitals and hurts their financial performance, but it's real pocketbook pain for patients. They could see impacted credit score, inability to purchase a home, and the consequences that come from living in medical debt, never mind the stress it brings to the family. And we know it's particularly dire for patients with health disparities. Patients that are in fact eligible for programs like Medicaid or Medicare oftentimes are not enrolled, leaving them vulnerable to debt when in fact they should have that bill covered. And what happens when there's a lot of medical debt floating around in the community? That just means that those costs are redistributed and spread, and everybody's healthcare costs go up as a result. So some solutions moving forward. We can be a lot more proactive about this. We can create programs and policies that promote seamless and comprehensive care and coverage for patients. We can focus more on the cost of insurance and ways to bring that down. We can think about the fundamental cost of health care in that conversation, and we can think a little bit more long-term. What would some more enhanced consumer protections and consumer assistance look like to proactively identify what healthcare costs could be coming up for a patient and make sure that the coverage is in place before that medical visit ever occurs? And we have COVID to think about as we roll through 2020 into 2021. It is not going to be a good year for patients or providers. The number of people dislocated from work and therefore health coverage was seeing increased numbers as 2020 continues. We can only imagine that's going to impact uncompensated care numbers when that 2020 report comes out. In the description below, we share with you the link to that Wisconsin Hospital report and where we found that number for the United States for uncompensated care in 2020, that January 2020 number. And we'll be watching for that 2021 report, and we'll come back to you with an update when that is available.